Hello and welcome back to my YouTube channel. This is Maureen Sullivan. I'll tell you in a minute why I'm smiling, basically ear to ear. Anyways, I am a registered nurse and a certified diabetic educator. And yesterday, yes, just yesterday, I launched my introduction video in what I hope will be a all hands on deck kind of a participation of creating a YouTube channel focused on diabetic education. As a diabetic educator who's also worked many decades, as I hinted yesterday, in emergency room and frontline nursing arenas, I just have seen too many persons with diabetes that suffered unnecessary complications and side effects from medications or uncontrolled diabetes or medication interactions. And I just wanted to put a little more action out there and a little more knowledge and accessibility to education for everybody, not just certain platforms or certain social media outlets. So the reason why I'm smiling ear to ear during too much of this video, I'm sure, is that since I launched my intro video yesterday, two great things have happened. I am soon to hit the threshold of, get ready, drum roll please, a double-digit viewer audience. Not subscribers yet, hint, hint. Click, share, like, subscribe. I believe that's the verbiage on YouTube. Anyways, I really appreciate anybody who's taken the time in the last 24 hours-ish to acknowledge the emails and messages that I sent them and check out the intro video and give feedback on topics that they themselves are interested in learning more about. So it's going to be a team collaboration. And I hope that some of the team members will step up and we might even do Zoom interviews and put them on this channel. So I'm excited about where this could go. The other thing that has me smiling most inappropriately at this point is that in those first 24 hours, I did a deep dive and I watched a lot of YouTube videos on how to get your channel up and running. And all the masters, all the ones that had, hundreds of thousands of subscribers and were claiming to be monetized and making billions of dollars, they all said the same thing. And get ready. They all said, just do it. Just do it. Just put out those videos here. Challenge yourself to put them out. They're not going to be the best quality. You'll learn as you go along, and I got that. But every one of them assured me in their own subtle, not so subtle way that the first 10 videos that you put out on your YouTube channel, whatever the content, whatever your level of expertise, well, the common verbiage here was that all those videos will suck. You're right, they will suck. So here I am on video number 2. Get ready. So again, thank you for the feedback. Thanks for sharing the link and just for viewing and coming along with me on this new venture. But today's video is on a term that I really do want to get a little bit serious about here, and that is on diabetic distress, meaning the stress levels that persons with diabetes and or their family members and significant others are feeling dealing with this chronic medical condition. Left untreated, and I've seen this personally happen with so many people, that stress level gets so out of control that it becomes a burned out situation, meaning somebody just cannot deal with the daily requirements of managing a chronic medical condition. Now you ask, why does this happen? Why do we allow it to happen? And a lot of times there's a lot of reasons for everything, as you might well know, that things get out of control. But I have a list here that I've taken off of the American Diabetes Association website, as well as the Centers for Disease Control and Prevention. So those are two very, very reputable websites when it comes to chronic disease management. What causes diabetic distress? Well, living with diabetes, a day-to-day, 24-hour-a-day situation here. The frustration, the burnout, the guilt. Some people believe or have been told or led to believe that they caused the situation by eating a certain way and not exercising enough and not losing necessary weight. And so they have a lot of guilt around that. A lot of anxiety about doing something in terms of blood sugar checks several times a day, navigating the financial elements of monitoring and managing a chronic disease such as diabetes, where there's glucometers and there's medications and there's a lot of meal prep that goes into this and a lot of nutrition label reading, and it is non-stop. It's bombarding non-stop. Compared to other chronic medical conditions where a lot of people, myself included, just take a pill once a day and it's pretty well managed, the world of diabetes just doesn't go like that. It's something that you have to be very cognizant of. Maybe we all need to be a little more cognizant of our overall health and well-being, but once someone is diagnosed with prediabetes or diabetes, they have to have another layer of interest in their own self-care. So the demands of daily care, as I've hinted, the long-term complication risk is always out there. You're always worried about, if I don't do this, if I don't control this, if I'm doing everything right and it's still not working, am I putting myself at higher risk for a complication? And then also, as I've hinted, the financial implications of dealing with a chronic medical condition. For many people, and I've seen this, and I know that if you're viewing this and you have a history of diabetes, or you know somebody close to you that has diabetes, you have seen what I'm going to tell you, and that is somebody deciding, what bills do I pay? What foods can I afford? Because I have to balance it with my monthly medication prescriptions, and that can get very much out of hand. All of that can elevate your stress levels, which ironically, no joking here, ironically, the elevated stress levels can increase inflammation. That can cause an increased blood sugar, and you have this vicious cycle of going on. I'm under a lot of stress, I'm causing a lot of inflammation, my blood sugar is going farther up, more stress, more inflammation, and so on and so on. So that being said, what can you do as a person with diabetes, or someone that you love have diabetes? What can you do to lower those stress levels and make a management of a chronic medical disease or condition something that is doable? Now, it may not be 100% doable 100% of the times, but something that gives them a little peace of mind. Everything that I read, excuse me, on those two websites said at some point you may need to literally make a list of things that has to be done every day. And the reason for that, in terms of chronic disease management, there is something psychologically beneficial if you see that you are checking off, I did this, I did this, I did this. And there's some, self-care element, a little, pat on the back, I'm doing what I need to do. And so a lot of times people have said they have to make lists because there's so much to do that they may forget what to do. So that's another reason why a list is not a bad thing. Also, surround yourself with support, whether it be reaching out to your medical provider, finding other people that are experiencing chronic medical conditions, support systems within your hospital setting, your clinics in the area, senior centers. Being around somebody else that is going through the same situation, there is a level of comfort there to know, hey, I'm not in this alone. And it may mean also bringing in family members to hear, hey, we're not the only ones suffering, if you want to use that word. We're not the only ones experiencing this level of stress. There is a support system out there. You may need to ask your physician for referrals. You may need to go to your local hospital and see if there is an ongoing support group there. There are a lot of them, and once you start asking, you'll be very surprised. And I personally have just gone onto the internet and Googled diabetic support groups and my area code, and I found stuff that I, as an educator, didn't even know existed. So we're not spreading the word as well as we could, and that is kind of why I wanted to do this YouTube channel, if you will. Also, when it comes to medication costs, the other thing that I wanted to talk about is there's a lot of different medications available. There's a lot of different price points. There's a lot of different insurance companies and or self-pay. And so if you cannot afford your medication, you must speak up to the person prescribing it to you and go, look, I appreciate that you want to put me on the newest medicine. I can't afford it. My insurance won't cover it. This is too much out of pocket for me. You have to be upfront with them. You can't just say, well, I'm going to somehow work it out. I'm going to give up something or balance the books differently at home, because that adds to the stress level. And I can tell you, having seen it happen so many times, at some point if you can't afford that medication, you are going to, and I hate sharing this, but this is a transparent moment here, you are going to possibly consider taking half the medication or skipping a dose of medicine. And once or twice, that may suffice here. Not saying to do that, but it may suffice and you may get away with it. But long term, you're going to be in an emergency room or a clinic, and that's not how I want to meet the people that are coming with me on this journey. So if you can't afford your medication, speak up. And I almost feel like I should wear a badge or put something on the wall that says speak up, because I wouldn't know as your provider necessarily that you can't afford this medication. I may think that it's at a price point that's good for you, but I don't know your financial situation at home. I don't know that maybe you have a multi-generational family, multiple generations living under it. Your finances are stretched. You have outstanding debt you must pay. If you cannot afford it, you must speak up. And I say that for many reasons. The majority of pharmaceutical companies, pharmaceutical providers, if you will, they have what they call PAP, not the PAP gynecology version, but a PAP, Patient Assistance Program. It's often not on that website until you kind of deep dive in behind the scenes here and customer service and ask them. But the Patient Assistance Program, they often have sliding scales, they often have complimentary samples, they have patient support systems in place. They can often get you aligned with another company that is offering a discount or discount coupons. So there are many ways to do this. Open the dialogue with your medical provider, and if for some reason you don't do it there, definitely stop into a pharmacy and ask them. They may have avenues that I personally don't know as a registered nurse, but there's also these cards, the GoodX cards, the single care cards, needymeds.org. It's a website with a lot of information on that. There are tremendous ways to make medications affordable. Not the best price point all the time, but in the majority of cases, there is some price point that becomes a little less painful in the wallet, if you will. So those are all ways to lower that stress level. Lowering that stress level brings down that distress about I'm living with a chronic medical condition here. And for many people, you can reverse and you can control the situation. But as we get older, as we're put on different medications for different reasons, the aging process, there's a tremendous amount of issues that at the end of the day, you may do everything right and your blood sugar is still climbing up for whatever reason. So you have to understand that you can only do as good as you can under the situation here, and that some days that good is going to have to be good enough. And I know that that's a big word because we want everybody to be in a certain blood sugar parameter and we want an A1C of a certain thing, but you have to accept that some days good is going to be good enough. I might have to patent that. Anyways, so that is it in a nutshell here. Again, ADA, the American Diabetic Association, their website is diabetes.org. Centers for Disease Control and Prevention, hit that search engine on their site, type in diabetes, a wealth of information. CDC.gov is their website. For now, is it too early to say like, share, and hit the subscribe button? Maybe. But anyways, for more information, also check out my website, MaureenSullivanRN.com, because on there is a blog on diabetic distress and the prevention of burnout. So I'm covering it on many different avenues. But for now, thank you so much for tuning in. And I believe, having watched a ton of YouTube videos, I believe I'm supposed to point down to hit the subscribe button, folks. Okay? Have a great day. Tune in because I'm going to challenge myself, maybe 10 videos in 10 days, since the first 10, well, they're going to be a challenge. Anyways, have a great day. Thank you.